So I'm a board certified psychiatrist and I've coached over 160 PMHNPs with clinical confidence with diagnosis, treatment, and taking better care of their psychiatric patients. And today we're going to be covering the biggest problem with NP education. I'll tell you a story. I remember when I was in residency, we were in my third year, and that's our outpatient year. We had this new patient come in, and we were all analyzing the patient case as a group. The patient was on 3 different serotonergic medications. They were on sertraline, Prozac, and duloxetine. We saw this regimen and it was like, what is going on? This is not a good regimen. And I specifically remember one of my co-residents, he raises his hand and goes, "Who's the NP that saw this patient?" That's the perception that most physicians have about NPs. They feel that they don't know anything, they're incompetent, that they shouldn't be practicing medicine. This is all very common, and you might have experienced this yourself. Of course, I think it's all stupid. I think a lot of it stems from scarcity mentality. Quite frankly, I think they're scared like of scope creep and NPs might steal our jobs, when in reality, if you look outside, you see that there's more than enough mental health patients for all of us to work with. So that's not something that I am worried about. And I feel that as psychiatrists, we can take mentorship roles for PMH rather than just talking behind your back or gatekeeping the knowledge that we have. Because in the end, we're all part of the same team. But NP education does have a problem. My students have told me this. I've done podcasts with other NP leaders in the community, and they've said the same thing. So here are some of the biggest problems that I have observed. So let's say, imagine that you're a nurse and you are wanting to become an NP. You want to be a provider. You want to make more money. You've been working on the floors and you want to service your patients at a higher level. That's all very admirable. And then there's this NP tract that's available. So of course, you're going to take this tract. Doctors will say, go to med school. But why would you go to med school if you're already in the nursing field? You go through the path that's already laid out in front of you. So that makes complete sense to me. But here's where they get you. A lot of these NP schools will just take your money and not teach clinical psychiatry. A lot of my students have told me that in their NP programs, they learned nursing theory, leadership, and doing essays and papers. Yet when you finish PMHNP school, you barely know any clinical stuff, because a lot of times, so there's decreased teaching, decreased preceptors, good preceptors, decreased good preceptors. So the way that you learn, for example, in the medical model, the way that I learned psychiatry is first you learn the fundamental knowledge. So we learn the fundamental knowledge in med school. Then you see a great volume of patients in 4 years of residency where you get supervised. So, right, decreased hours here as well. As a resident, by the time I finish psychiatry training, I probably have over 10,000 hours in the field of psychiatry. Whereas a lot of the NP programs are like 500 hours. It's not the same amount of clinical time, and you need that volume. You need those reps in. And then secondly, you have less hours and don't have good preceptors either. A lot of these preceptors will just either just take your money and have you sit around and don't know anything themselves, or they don't provide the consistent mentorship you need. So in residency, every single patient case I saw, I staffed with an attending physician. So let's say I saw a case and I was like, okay, I think we should do X or Y. And the attending's like, no, I think this would be better, or this medication would be better, this treatment would be better, this dose would be better. But you get a fraction of that through the NP school pipeline. So you have less supervision. So you're doing things yourself. And so because you're doing a lot of stuff yourself, you don't know what you don't know. So you don't know if you are messing up or not, because you have no one to teach you and guide you. Just like if I was trying to learn basketball, I can try to shoot hoops all I want. But until I have a coach who says, okay, hey, don't put your hand like this, put your hand like this, don't put your feet like this, put your feet like this, stuff that I wouldn't even know to check, they know to check. Every pro athlete has a coach. So that's why, every healthcare provider should be having their own coaches as well. But you have such a dearth of that level of supervision in NP education. What COVID did was it created all of these factory schools where their goal is to just pump out graduates. Their goal is not to really educate you and prepare you to be an excellent psychiatric provider. Their goal is to just teach you a standard curriculum that you get through that's accredited. Once you go through that, they pump you out to get the next person going because it's a factory. It doesn't matter how you do after you're done with schooling because you've already paid the high fees to get through school. And now with online schooling, a lot of stuff really slides through. I've had many colleagues who've had good education. For example, in our NP coaching program, we've had excellent education, but a lot of them say they have not. They went through the online school and they had no idea. They just kind of went through the pipeline. And then they realized, oh man, like I am not learning anything. And now I'm getting in the field and boom, it's overwhelming, especially with complex psychiatric cases. Psychiatry is not very algorithmic either. So because it's not algorithmic, there's very little that you will actually you have to figure a lot of stuff out and you have to develop your own style. But the only way you can do that is from mentorship. There's a concept called tribal knowledge, and tribal knowledge means that it's hard to find this in books, but it's passed down from mentorship, mentor to mentor. Plumbing, right? You have mentors, apprentices. It's the same thing with psychiatry as well. It's passed down from a mentorship model, and teacher passes on to student who becomes a teacher who then passes on the knowledge. That's how it works. And you can only learn so far with books. Like I have all these books. I've read so many psych books, and you don't learn as much as you do from seeing a patient, figuring it out, failing, and then having a mentor correct you and be like, no, this is the way to do it. If you're interested in mentorship, a great place to have that for PMHNPs is our coaching academy. So definitely check that out. Now, let's say you've kind of gone through the school pipeline. You have to find your own preceptors. I've had so many requests ask me, can I preceptor them? And I'm like, wait, what? Like, shouldn't that be your school's responsibility? No. These preceptors, like they literally have you find your own preceptors, which is complete horseshit, complete garbage. When I was in med school, when I was in residency, I knew exactly where I was going to be every single day because all of that was in the pipeline. When I started third year of medical school, okay, we have our OB-GYN rotation for 6 weeks. You report here, you go to this surgery. When you have our internal medicine rotation, 8 weeks, 12 weeks, you go here, you're part of this team, you show up at these hours, you report to this attending. Like all that's mapped out. So you follow through the process and then you get out as a trained physician. And then same thing in residency. In residency, we had 6 months of inpatient rotation and 6 months of consults and neurology 2 months, and then outpatient for a year, and then electives for a year. So everything is scheduled out. I never had to find my own preceptor. It was all taken care of. So the fact that you have to find your own preceptor is complete garbage. So what that tells you is that the quality can vary because preceptors will get paid. Their incentive is to take on as many students as possible. But of course, they're busy with their own clinical practices. They are rewarded by taking on quantity of students, but now doing less for them because they don't really get paid more the better that you learn. So that you have to find your own preceptor. Then you also have to find a collaborator, especially once you go out and practice. So you have to go out and find a collaborating physician, especially in a lot of states. That quality can vary too. Some of the psychiatrists you might collaborate with may be great to reach out to for mentorship and teaching, but a lot of them might just take your money and barely be responsive because they know that you have to do it for the legal requirements. So that can be a trap as well. So you got to find your preceptor, you got to find a collaborator. Now let's say you do land a job. Then you have predatory workplaces. So they know that you don't know your worth. They can underpay you. For example, one of the NPs I work with, she's looking for a new job right now. And she says that this new place that she's looking at offered her $100 an hour. She asked me if that was good. I was like, $100 an hour? Are you serious? That place is probably making $600 per patient. Let's say you make $200 per patient, because with every patient you see, let's say you see a patient in the insurance system for 20 minutes. I don't do this because I do private practice integrative work, but in the insurance model, you might get $200 of reimbursement, give or take. So now times 3 per hour. So that's equals $600. And they were going to give her $100 per hour. That's W-2, so then, even less. A lot of these places, their goal is to use you as a cog to pump out patients. The private practice is only going to make money by you pumping out patients. So there's no incentive for that to be a learning environment for them to teach you, because their incentive is to use your labor. That's why it can be such a huge problem for a lot of NPs that I've seen. And so finding a good workplace is super important. But because the education system is not that good, you're not really prepared for that. You might have written 20 essays, but no one has taught you about the business of medicine. And that's something that I think that every provider should understand. So that way they go in with an informed decision of what they decide to do. So, I've had providers, one of my NPs I work with in our coaching program, just quit her job. She gave them a 3-month notice because she's like, I was seeing 30 patients a day. And that's not safe for her. She's burning out. That's not safe for the patients, like the patient care. It's not safe for them. It's just not a good situation. So that's something that you need to be very, very cautious of as well. And then lastly, what all this does is it leads to people doubting you. When I go into any kind of professional interactions as a psychiatrist, my credentials and my experience are immediately respected. When I meet another psychiatrist, I automatically assume that they have a base level of training and we can talk in psychiatry because we've gone through the same experience. And so I know that they have this shared level of baseline knowledge. But one of the NPs that I have in our coaching program, she told me that her last job, at the interview, they were asking her clinical questions like, if this case comes up, what would you do? What kind of medication would you use for this? What are the top 3 things you would diagnose this person with? What are the top 3 treatments that you would use for this person? I don't get that. Whenever I've been on a job interview as a psychiatrist, they're trying to recruit me. Like, my level of clinical expertise is already assumed. Whereas in the NP case, that's not the case. As I heard one of my NP students say, if you've met one NP, you've met one NP. Many of them can come in with different experiences as well. So it's that no work experience. And that is a consequence of the direct entry programs. So a lot of them, you get your RN and then immediately go into NP school. But now you skipped a fundamental part of the NP education. The way the programs were designed was on the basis of already having prior work experience. If you've worked in the psych floors, for example, you have given out Haldol, you've seen the side effects, you've seen how patients react to it, you've seen how all the different medications being used, you've seen psychiatrists using X or Y things, you might have picked up on some of the rationales and things, you've given the injection. So as a medical student in my field, I had to learn all that stuff. That's why medical education is a lot more intense. But if you don't have prior work experience and then you go into direct entry, you're not going to have the prerequisite experience to really make use of the information you are learning. You can't really contextualize it. Whereas someone who's been working in the psych floor for 10 years, they're going to have a lot easier time going through NP education, psych NP education, because of that. But now, because they don't mandate this, and again, because their goal is money to pump out students, that's why a lot of NP education is really struggling, because they don't tell you that. And then going back to people doubting you. So if you've heard of the subreddit, it's called r/Noctor. It's basically like doctors shitting on NPs and NP education. I actually got banned from the subreddit because it found out that I was helping NPs. Physicians will doubt you. Patients will doubt you. They will say, I want an MD, I want a doctor. The community will doubt you as well. And like if there's an NP education problem, then it makes sense for them to do it because they feel that the education is not as good, so the patient care is not going to be as good. That's the advice I give to my students. You see all this stuff, right? What do you do about all this? You're a nurse, you're an NP, you want to provide the best care for your patients. You understand that the system might be rigged. You understand that the system is designed not to fully give you the best education possible. You understand this and you want to get better. be clinically excellent. No one can doubt your skills. You have to go through all the problems if you want to practice as a Psych NP. What you can change is your work ethic, your drive, and your willingness to learn and understand psychiatry at a deep level. If you came into this field just for home life, cush, post-COVID, yeah, you want to work from home or psych is easy, then you're in for a rude awakening. This is not for you. However, if you're passionate about psychiatry, you love it, you have a deep appreciation for it, and you really want to be an outstanding provider, you will have people doubting you, right? You will have gone through the system, but what you can do is become so clinically excellent, no one can doubt your skills. And one way to do that is through our NP Coaching Academy, where we've had over 160 providers become outstanding clinicians. I'm a board certified psychiatrist. I teach this stuff online. I've spent over 5 years learning this stuff. I'm still learning every day, but I've spent over 10,000 hours learning psychiatry. And my goal is to download all the information I have, all the thought processes, how I handle patients, how I do treatments, how I conceptualize cases, and give it to you. So that way you have the education that this system never provided you. So if that interests you, you can check that out. But otherwise, I will see you in the next video.